I'm Dr. Michael Patterson, clinical psychologist and EMDR Europe accredited senior trainer. I run trainings and workshops for experienced mental health professionals. In this video, one of them is asking me a particular question. Please join us.
Thank you. One of my questions was about the processing phase, assessment and then the history taking. About when a patient has had a series of traumas which have been continuous, let's say for 2-3 years. It's about with regards to abuse, where you would potentially start with that. Would you start with the touchstone memory or earlier memory, or would you start with the current memory?
Okay, so well, if there's a series of traumatic memories related to abuse, then first of all we have to understand where's the client in this complexity continuum, because that could determine where we would start. So first of all, we will get the history. So let's say we've got abuse experiences within the home environment, maybe abuse experiences in school years, maybe it's emotional abuse or physical abuse or even sexual abuse by a particular teacher. There could be a series of sexual assaults through the teenage years, and then maybe a number of sexual assaults and even as strong as rape into adulthood. So we could think of these as a series of clusters. And even if we have a client with that, then I'm thinking the client is probably not here on the complexity continuum, but certainly well down, at least here, maybe even further. So I'm going to screen with the DES first of all. I'm going to try and understand how the client is functioning generally in life by taking a history and looking at challenging situations. So we may have to do resource development and installation with the client to create some internal stability. We may need to do schema work or ego state work as well to work with the different parts. So think about these as fragmented parts of the personality with their own patterns of thinking, feeling and acting that could be there through introjection, through the abusive parents. So there could be an abusive part of them. There could be something that's there through trauma itself. There could be like a Superman character that's there to keep them safe, and which acts out, and they're in a high state of arousal and angry all the time. So again, understanding the client, where the client is coming from. So then by taking that history, we get a good idea of where the client is and what we would need to do to help the client then function. So the preparation phase could range from 10 minutes for clients at this end of the complexity continuum to months and maybe well over a year for clients down here. When it comes to the starting point, then I would probably start with something with a client with that sort of history, with something that's more recent. So it could be a present trigger or a recent trauma or recent adult experience, and process it initially with the like of EMD. That way it keeps the client contained so they don't head off down the associative channels and gets them functioning in that particular environment. So as the client becomes more ready for processing then, and there are a series of traumas right through, then we may do an adult event as well, an abusive experience prior to doing the childhood experiences too, but perhaps using EMD at that point as well. So when I'm satisfied the client is able to regulate their affect pretty well, and with the understanding that lots of things could come up, and then I could move them to the earlier experiences. Now the thing about starting later, if you start in terms of the timeline, it's up here, and there's a whole series of earlier abuses. Although we start with one up here and it processes quite well, the SUD might go down to 0, but then it could reignite because of the earlier memories feeding up into that. So ultimately, by processing the earlier memories, then it means we can get a generalization effect to the later memories too. So let's say it's now we're moving to deal with the abusive experiences that the client has had in childhood at home, whether it's physical, sexual, emotional, or all three. And we want to ensure that the client's child state is contained. So we could have been doing exercises in the initial phases of looking into the child's eyes and what does the child need. So when it comes to the processing, we now have a child that's maybe pretty integrated, maybe even blended with the adult, so the child is safe. So it could be adult who's now processing the childhood memory, which isn't as impactful as it would have been, say, 6 months previously. So again, setting it up then with a picture that represents it for the client, negative and positive cognition, the VOC, emotion, SUD, feeling in the body, go with that and allow the processing to go where it needs to go. So when the client is well enough contained, then they might start off with the abusive experiences at home. They could then spontaneously link to the later abusive experiences. All of these could connect in, and then we support our clients through that so that he or she can continue to process. So does that answer the question?
Yeah, it does, absolutely. And obviously, working in an IAP service, it can be quite tricky because you start, you know, if you're starting with an earlier memory and then you've only got a set number of sessions, although we can go up to 20, but sometimes that's not enough either, especially like you said, if you're on the complexity continuum and you've got to spend a lot of sessions preparing and making sure the preparation phase is done thoroughly, you know, almost like they've got that body armor to fall back on. So it's just making sure.
And I think an important thing, given that you could have a limited number of sessions, is you have to cut the cloth to suit. And what I mean by that is that if you've got 20 sessions, then do your initial assessment of the client and where is the client is on this continuum of complexity. So if the client is from here down to here, 20 sessions, you're only getting started. And so I'd be thinking about, well, if only gets 20 sessions, I can do a lot in that 20 sessions, but I'm thinking about stabilization first of all. So resource development and installation, teaching them the diaphragmatic breathing, any other strategies that you have that you can teach them, by all means, do that. Any of those positive experiences that you can introduce. But it could be a case of prepare the client to cope with life as with this trauma, but because you've only got 20 sessions to do that in. Whereas if you jump in too soon without enough preparation, then you could open up the client and next thing they go out and self-harm or try and kill themselves, which would be even worse, or even be a complete suicide. And then bad for them, but also bad for us too, in terms of how you could function as a therapist afterwards. So
yeah, that's very helpful. Yeah, completely, Michael, I agree.
Yeah, and the important thing would be is when you've done that assessment and if you're being pressured to, right, get in processing, no, in my opinion, this person isn't ready or able to go there, and here's the reason. So don't feel as if you have to do it if somebody's saying, oh, well, we'll need this person processing through, we don't want them off the waiting list.
Yeah.
Client safety is the important thing.
Yeah, absolutely. Thanks a lot, Michael. It's really helpful.
Thanks very much.